726, welcome back. Great topic of discussion this morning with Dr. John Lepre. I appreciate it so very much. We're talking about this heat and how it actually can affect your mental health.
Oh yeah, definite hormonal changes that mimic changes we see in depression.
Which is crazy, all stemming from the heat. Okay, so let's dive into this first one here.
Yeah, I found this really interesting. Emergency rooms see a 7% increase in mental health visits during heat waves. The risk of suicide increases 2% for every 5 degrees above the monthly average.
Wow.
And for patients or people with mental illness, their risk of dying during a heat wave increases 2 to 3 times.
That is scary to think about, you know?
Oh, absolutely.
Especially in, you know, the South where it is predominantly pretty hot here in the summer. Let's talk about sleep disruption.
Oh yeah, that's a big deal.
Yes.
I had a little of that last night.
Really?
Your body, we talked about the stages of sleep, and your body actually requires a drop in temperature to move to the next stage. With a heat wave, it keeps you in that stage. It disrupts the entire cycle. You wake really tired, really cranky.
Obviously because you're hot, correct?
Correct.
Like you can't find a comfortable spot, if you will. So you're just constantly battling that REM sleep.
Your body's looking
Wow.
for that change in temperature, that ambient change.
Interesting. That might explain a lot. Let's talk about the impact of healthcare visits costs. I know that plays.
Oh, absolutely. I have another statistic for us.
Love it.
Each year, 235,000 ER visits and 56,000 hospital admissions just from heat waves. And all this is expected to cost about $1 billion each year, and that was last year's data. So it's only going to be higher as these heat waves get a little warmer.
And the longer they last, too, I'm sure. Like we're on day 10 of this
Gotta be.
excessive heat wave. Wow. Listen, we have 30 seconds left,
Okay.
so let's wrap it up with what do you want to close out here
Well,
with?
there was one thing I wanted to include I didn't get to do in our news stories.
Sure.
Is medication. So many of our medications out there affect your ability to handle the heat. Fluid medicines become really dangerous when you're sweating. And going back to some of the mental illness, a lot of those medications disrupt your ability to handle heat, your body to recognize it. So those become more
Interesting.
dangerous.
Any recommendations as far as just continue to stay hydrated? Water is a key factor there?
Hydrated indoors, stay out of this stuff if you can.
If you can.
Absolutely.
Okay. Well, listen, Dr. Lepre, as always, thank you so very much. We appreciate you.
Thank you.
We're going to send it to Adam to talk more about this heat.